All right, I think we're going to get started. Um, I'd like to welcome you to this virtual town hall put on by the DiabetesWise team. My name is Corey Hood. I'm a psychologist and professor, and I work at Stanford University. Our team here created DiabetesWise.org, and we intended this to be an unbranded resource for people with diabetes to learn about devices and also to understand the ways that it can benefit their lives. We did this through support from the Helmsley Charitable Trust, which is also supporting this series. One of the things that we've learned as we've been working with members in the diabetes community since the COVID-19 pandemic started is we've heard about new problems with getting prescriptions, seeing the diabetes care team, getting the support you need, accessing via telehealth. So the goal of this series that you're attending is really to help people during this very stressful time to learn some new strategies. And we want you to tune in each week this summer at Wednesdays at 4 Eastern, 1 Pacific to hear what we're working on. One of the things that we're going to do today as we go along is the format for today's session is for about the first 30 minutes, we're going to talk with a special guest, an expert in diabetes. And during that time, we welcome any questions that you have. So just put those into the chat and we should be able to get through all of those in the latter half of our session today. What I would like to first do though is put up a poll to find out a little bit more about who is attending. So this first question is about what's your connection to diabetes? So I'll go ahead and have that put up. So what is your connection to diabetes? Type 1, type 2, you care for a person with diabetes, you're a healthcare provider. And we'll give just another couple seconds. Okay, so maybe we'll end the poll there. And it looks like we have kind of a diverse group here. We have a number of healthcare providers, at least one person living, caring for a person with diabetes, and then we also have a number of people with type 1 themselves. So that's good to know. Thanks for sharing that. So I want to dive into the interview today. But I want to first acknowledge the support from a couple of our team members here. And you may be able to see them now, hopefully you can. Sierra Nelms and Monica Lanning have really been driving and if you're seeing it, Sierra's at the top, Monica's at the bottom. But this is our team that's really been very critical in putting this on. So thank you for your work. So I want to start by introducing Dr. Jay Schubert. We're really excited to have him join us today. Dr. Schubert's a board-certified family physician and diabetologist. He's been helpful and a critical voice as we've been ramping up DiabetesWise. He's a professor at Touro University here in Northern California, and we're really excited for Jay to be part of this today. Welcome.
Thank you for having me. I'm glad to be here, and I look forward to talking with you.
So I think, the first question I asked the group was about what's their connection to diabetes. And so I'd like to hear from you, what's your connection to diabetes? And I think, largely from a from a professional standpoint, you see people with diabetes, where do you work? Just tell me a little bit about what you do.
Sure. Well, my original training was in family medicine, and I really love the preventive and the holistic and the kind of health behavior component of family medicine and keeping people healthy. And I was practicing in Appalachia, Ohio, and I was getting more and more people with diabetes. And I love actually helping people manage chronic disease, which makes me a little bit of an oddball in family medicine. So my partners were happy to say, you can do all the chronic disease, we'll do the other things. And I started to realize that I really needed more support to do this well. And I needed to find some way to build structure so that if I'm going to focus on diabetes, I'm going to do it, and I'm going to do it well. And so we actually created a diabetes fellowship for primary care providers. I did a year of nothing but diabetes. And quite honestly, I've been doing only diabetes since 2004 and really have enjoyed it. I love the chronic relationship I have with the patients I'm working with. I love the math of diabetes. And I also love that there's a lot that we can do that doesn't involve medicine. And for me, that's a really fun part of it to help people find ways that they can be healthy.
Great. So, can you tell us a little bit about your practice? What's it like? And who are all the providers in there? What kind of types of diabetes do you see? Just tell us a little bit more about your practice.
Sure. So I am part of a team. So we have a couple diabetologists. We have a PharmD. We have a PA as part of our team. We have diabetes educators. So we are a team-based approach, and we have two practices that we work with. One is in a federally qualified health center. So we're actually embedded as a consultant in the middle of this health center, public health center. And the other is at a diabetes center, a diabetes and endocrine center. So I actually have part of my time in the specialty world and part of my time embedded in primary care. I do adult and pediatric, which is also a little bit unusual because of my primary care training. And I see all types of people with all types of diabetes, complications, hypoglycemia, but it's all glucose and metabolic related.
Yeah, that's great. And I think, and hopefully, the people that are attending, are going to learn some things from you. But I mean, you really cover a pretty wide range of ages and diabetes types and everything. So we're really glad to have you talk with us. I think, part of the reason for doing this town hall series was to think about like what's new, what's different, what's changed since the pandemic started. And so I guess I'd like to hear, if you were to compare what you were doing, January and February of this year to what you're doing now, what's different about your practice and how are you interacting with the people that you see with diabetes?
Yeah, so just like everybody else, the COVID world has changed us dramatically. And I think that a number of things are different. One is we've learned a whole new set of efficiencies. There are ways that we can see patients more frequently, but not face to face. And we can do that well. So that's something that we've learned. We also learned that people like connection. And boy, so many of our patients have been so diligent about staying inside and keeping themselves safe, but also then really taking a hit personally, psychosocially, and even their health by being so isolated. And I think because we're social creatures, I think that I underestimated how hard it is for people to socially distance and shelter in place. And then I also think that we've learned, as much as our technologies have served us, boy, you change the paradigm and boy, you got to change all the workarounds for your technology. And that's really been the hardest thing for us to adjust to, is how do we get the same level of information, data sharing, when the interaction has changed?
Yeah. And are there some things that you, how do you, this maybe seems like a little bit of a weird question, but how do you start a visit with somebody over telehealth? Is it the same way that you would do it in person, or do you do something different?
Well, if it's a brand new patient, it's actually probably pretty similar to a live visit. I always like to ask someone, I want to confirm you're here to talk about your diabetes. Yes. Could you tell me your diabetes story? When were you diagnosed? How were you diagnosed? What's been your experience? And I find that open-ended question gives me a lot of really valuable information as I try to approach the patient and help them develop a treatment plan. If I'm doing a virtual visit, I feel we really have to kind of connect. And so often I'll say, how are you and your family doing? Has your family been well in these times of COVID? I think that some of that connection is important, because this is a bigger thing than just diabetes that's affecting all of our health.
Yeah. And what do you think, you'd mentioned a little bit about, that you're able to stay a little bit more engaged and see people. What's your take on what the patients and people with diabetes think about doing telehealth? Like, what's your, do they say anything back to you? Do they like it? What are your thoughts on it?
Yeah, well, I think people are people, and I think there's a lot of different responses. I think for many people, not to have to drive to the office, not to have to wait for a long period of time. There are so many apps now that do telehealth. I text my patients, hey, it's time for a visit. Is this a good time? I mean, that's really convenient, I think, for a lot of people, and they like that convenience. Saying that, technology sometimes fails, and in some where we have a video visit, we have to switch the phone. Sometimes patients will say, you know, I really would like to see you, and I would of course like to see them. So I think that for some people, convenience is much better. I think for some, the connection's not the same. And I think that, you know, it'll probably be one thing that will change for the long haul is we'll end up doing a hybrid of this. We didn't do a lot of telehealth before, but I certainly see the benefit of telehealth now, particularly for focused problem solving between visits. And I think if that gives our patients with diabetes more access, that's probably a good thing.
Yeah. What are some ways that you follow up? You know, I like your comment about the problem solving. So say you identify some problem and you help someone with a goal and they're working on it. Are there ways that you know, now that they're able to get back in touch with you a little bit more easily than they were before? Or have you noticed anything like that?
Well, we have in one of our practices, we have a patient portal. And so I think that gives patients pretty good access to give feedback back and forth.
Yep.
That's been the same. You know, one thing that I am doing more clinical time now that we're doing it virtual, because I feel like we want to make sure people's overall health does not decrease. And so I'm actually seeing people more frequently than I was before, because we're actually taking smaller pieces of information, smaller problems, and addressing those one at a time. And I think there's less pressure because there's not the 2-hour drive to and from the office. There, you know, the amount of time committed, hopefully, is not more for the person who's coming for the appointment.
Yeah, yeah, that's great. And I mean, you don't have to sell anybody out, but have you noticed any of your colleagues or providers who are, you know, not so crazy about the telehealth? Or is there anything that some people on the provider side that they don't seem to like about it?
Yeah, I think that there are a couple challenges. So I think we go to the assumption that if you have a telehealth appointment, you'll actually be at your appointment. Yeah. I don't know why we make that assumption, because life happens, you know, emergencies happen. But so if that appointment gets missed, trying to fold that back into the day is sometimes a little bit harder, and it can really change the whole schedule. And I had someone who had a hypoglycemic episode, and they were addressing their hypoglycemic episode, not answering the call, which I think is a good choice. But when they called back in, we were trying to fit them back into the appointment because, of course, we'd want to, but it set the schedule off. And I think sometimes you have to be flexible. And I think the other people are like, well, how can you be off? You've got these appointments just by phone. So I think understanding the rules of engagement and that life still happens can be a challenge.
Yeah. Well, to switch gears a little bit to thinking about, you've already talked a little bit about devices and technologies, and you know, I know that you know, one of the things that you know we do at DiabetesWise.org is to present information on insulin delivery devices, whether you're talking about you know, doing multiple daily injections, pens, or if you're doing the insulin pump, and we do a lot around continuous glucose monitoring. So tell me a little bit about what's just your take on using devices and technologies, and is it widely used in your practice? Maybe tell me a little bit about your thoughts on that.
Sure. So I think in family medicine, devices are not widely used. And I think that it's just a lack of knowledge and experience with it. And, you know, quite honestly, technology makes our visits more efficient for most of the time. And what it allows us to do is see patterns and allow us to really do focus problem solving on things that are not isolated events. So I think in terms of doing that, I think that's worthwhile. We had a very nice system set up when we had face-to-face appointments. There was a kind of a network or a protocol where you would download your device, you bring your materials over, then we could talk about it. It's been a little bit trickier doing that virtually because some people have the skill to upload at home and then we can look at it on the cloud, but there's other people that haven't developed that skills, or we haven't developed the infrastructure to be able to see that in a timely way. So in some respects, I think we've taken a step back with devices during this time, and we're trying to catch up. But I think that that's largely a user issue, not a device issue. I think the devices have developed a way to for us to share data. We just have to figure out how to do that. But for me, I think a device is critically important to help a patient or a person know with diabetes what affects their diabetes, and it gives them real good information for time-to-time decision. And I think for me, it helps me to triage which sort of things we're going to focus on if there isn't a particular problem the patient's coming with, because of course they may have something that they want to address.
And since the pandemic happened, I think it's still ongoing, but what have you noticed any differences in the ways that people with diabetes use their devices and technologies? Have you noticed, for example, that people use them less, they use them more, they have you talked about the issue there with sharing the data sometimes, but have you noticed any trends about the way that people use them in this era?
Yeah, so I think there has been, at least for the people I've been seeing, some have thought, well, my life is the same, I'm not going out, so I don't have as much variability, so I'm going to use my technology less. And again, that's a personal choice. So I think that someone should be able to choose that. I would also say that our life is entirely different, and we have to learn a new pattern. So sometimes that device might give us really good information about our new environment. For me, I'm trying to be a resource for my patients with diabetes. I want to be a source of information, a source of tools, and the technology is also that. So I want to make sure that we're offering things and providing things and discussing things that are going to help them thrive with their diabetes. And so if they want to use it less, that's no problem, as long as they feel like they're meeting their goals and then we're helping them, live the way they like to live.
And have you noticed any issues with people getting prescriptions or getting their devices on time? I mean, delivery issues. I mean, have you noticed any of those?
Yeah, I would actually say for the providers out there, one of the things that our practice had to learn is that we have kind of a policy that we give enough refills for, let's just say, medicines at first, till the next appointment. And so if someone's calling for refills, we should be looking, are you due for an appointment? Well, in the time of COVID, that has really changed. And so we had to not, I think there were rejections coming through from our office that really we shouldn't be rejecting. I mean, this is a time where people really need their medicine so that they can stay healthy. So we had to adjust and say, look, let's abort that protocol. Let's make sure people have 90 days worth of medicine. And I think for our supplies, it hasn't changed as much because it was all online anyway. So, in terms of whether it's CGM or pump supplies, those things we were doing online. So it didn't change as much. And I don't feel like the mail delivery is as liable for medical things as it is for other things. So I don't think my patients with devices have been affected as much.
Okay, and that kind of nicely cues up the one of our next poll questions, where we wanted to find out from the attendees what's changed in their lives since COVID, the pandemic started. Are there? And I think some of the responses are, loss of insurance or difficulty making appointments. So you can see here on the poll, but we were just interested to know. Have you been impacted by any of these following since COVID pandemic started? And it's multiple choice, so you can choose a number of them here. But we'll give everybody a couple seconds to respond here. We see a lot of responses coming in. That's good. And we're kind of seeing that, unfortunately, a number of people that are attending have had some type of job loss, which is obviously a significant stressor, and then also, unable to go into the office or not able to schedule as many appointments. So maybe we'll give just another few seconds and then look at the results. And maybe Dr. Schuberg, I'll ask you to comment on the results if you'd like to. But Monica, could you show the results now? Yeah, thank you.
Yeah, so I think it highlights something that's pretty universal. There's been a lot of job losses. There's been a dramatic decrease in the number of appointments as it relates to diabetes. And I think part of it is our job to say, we're still here for you. We're just going to connect in a different way. And talk about the validity of virtual appointments as still being part of it. certainly scheduling with a provider can always be a challenge, and it can be a big challenge if it's a new format that you're not familiar with. But yeah, this is pretty typical for what we see in our practice as well.
Okay. And that goes into, you know, one of the other questions I wanted to ask you, which is um, the have you say someone wants to start on some kind of new device or new technology. I mean, it could be an insulin pen, it could be insulin pump, it could be, you know, continuous glucose monitoring. We know the Libre 2 was just approved. I mean, there's a lot of things happening and a lot of, but I would guess from hearing from some people that they're a little bit worried about starting something new at this time, but also how do they actually start it if they can't come into the office for a visit? So what are you doing on that front?
Sure. So I think that's a multiple step process. And I think first of all, I like to ask what it is that they're trying to achieve with the device. We do use the DiabetesWise site quite regularly, and that's a nice way for people to kind of decide what they want. We also send them to all the commercial websites if they want more information. When they're ready to start one, we have provided both telehealth, pre-pump, pre-sensor training, and a lot of the companies have done that as well. So I think that it's not the same because, again, sometimes putting your hand on something feels really different, but it is certainly a step. And I think, you know, we just had 2 people yesterday that did telehealth pump trainings, and they had their pump in their hand. The trainer kind of worked with them, and they seemed very comfortable at the end. And so I think that may not be for everyone, you know, and we do have some live appointments. So, you know, one of those people we might say, okay, come on in and we'll do the second half of that live. But there is a lot of telehealth available to support people with devices.
Okay. And in your practice, and one of the other things I'll ask the attendees, but in your practice, you know, I know that you mentioned the family medicine side, but in your diabetes cases, and we could maybe start with type 1, and then we can also talk about type 2, but in the people you see with type 1 diabetes, how many of them are using these different devices, insulin pumps or some way to monitor their glucose other than a meter?
Yeah, and so remember, I have 2 practices. One's in a public health setting, one's at a specialty center. And I would say that probably 75% of the patients in the diabetes center have some device that supports their type 1. And I would say it's probably closer to 55, 60% in the public health center.
Okay.
We're lucky enough to have very good coverage for devices for type 1. So I think that many more can get it if they want it. But I think often we don't give patients a good enough exposure to know what it is. And so if they go on preconceived notions, or maybe they haven't gone online to look, they're tentative. But I think when we compare someone up to say, hey, this person's tried that, would you like to talk with them? I think a lot of times insurance is not the thing stopping them from getting a device if they have at least Medi-Cal or private insurance.
Okay. Okay. And then what would you say from for people with type 2 diabetes who are on insulin? I know I'm kind of carving it up into a small bunch for you, but you know, for people who are on insulin, type 2 diabetes, you know, are they using devices, and do they have less access than the type 1 group? What are your thoughts on that?
Yeah, so I would say that the coverage is not nearly as good for CGM or pumps as those devices for type 2, even on insulin. If you're on 4 shots a day and you're checking 4 times a day, you could probably get that through one of the insurances. But most of our requests come through for CGM, and often they don't qualify for it through insurance. So I would say maybe 20% of my patients with type 2 have some kind of advanced device. But I remind them the meter is a device too, right? The meter gives you incredible information. But yeah, I think you were talking about CGM or pump, right?
Yeah. No, but you're absolutely right. I think that's a really good point. Sometimes we get so far ahead with the, you know, newest and, you know, the latest and greatest, we forget that you can do a lot with a meter, and you can do a lot with trend programs from that. So and so I was going to ask kind of poll the audience on their understanding and their use of continuous glucose monitoring. So Monica, could you bring that other question up? Yeah, so how familiar are you with continuous glucose monitoring? And the, responses, I use one, I used to, I don't know anything about it. I've seen ads, my friend has one. I think that if you could give us a little sense of how much you know about it, that would be great. Looks like we have a little over half the people who have voted. And so any other thoughts on it would be great to chime in. It seems like we have a number of people who are familiar with CGM. But then there's a whole group of other, which maybe as we get into the Q&A, we can learn a little bit more about that. But when you are trying to introduce the idea of using something beyond a meter, continuous glucose monitoring with the different ones, how do you present that to people with diabetes? How do you talk about it? I think we'd be interested to hear how you bring it up.
Sure. So again, I think it's all around the framework of how can I be a resource for my patients who I treat with diabetes. So if someone has diabetes and they see something that's unpredictable or they're concerned about, I think hypoglycemia is always one of the things that makes me think about CGM. Or if they have some bounciness or irregularity in the readings, if they're feeling overwhelmed with the number of finger sticks, or let's say that their job is such that finger sticks become difficult, this is a tool that would help provide more information. And I think that it is intended to be an incredible tool to give immediate feedback on how your life affects your diabetes. So to me, that would be one of the most valuable things, as well as what I think is this bumpers. Those bumpers in a bowling alley to say, hey, when you start getting close to the high or low end, this could actually help you to know that, because maybe you'll feel it, maybe you won't. And so this is a tool. It's not required. It is something that might be helpful. And I try to lay out that these are the benefits of potentially this device. This would be the liability. You have to wear it all the time. You have to maybe calibrate for some of the CGMs, don't calibrate for others. You do sometimes have to use a finger stick to check if the sensor reading doesn't make sense. But does that sound like something you'd be interested in? And I think for most people who are doing active management, more information usually is a positive thing. Not for everybody though. I think some people get really overwhelmed by having too much data. And so, I think it's not for everyone, but it is a powerful tool for people who want more immediate information that they can act on if they are willing to trust it and they're willing to engage it.
Yeah. No, thanks for that. And I think that, a couple of points that you made, I think are really important about, from your perspective, it's up to the person, and you and your practice are going to do all that you can to be supportive of that. And that's great. And I think that's a message that, I think really resonates with people with diabetes, to feel supported in that way. So I appreciate you advocating in that way and thinking through it. I want to get to some of the questions in the next few minutes from the chat. And just a reminder to everybody, if you do have other questions, just drop them in the chat and we'll make sure that we answer those. I'm interested to hear what you think is going to happen, for the rest of this year related to diabetes care. Do you think things are going to change? Are they going to be pretty much this way? And then what do you think it's going to be like? You mentioned it seeming like a hybrid in the future, but just, what do you think is going to happen in the future with diabetes care?
Boy, some of it I just don't know. I think that we're kind of learning as we go along. I like to always be a pretty optimist. I'm always looking at the bright side. So I think that if I have more ways to engage with my patients, that's going to be a positive thing. I think we have to get past the message that just having diabetes is going to be a death sentence for COVID. I have so many patients that are afraid, and I'm like, if you have good metabolic control, you really have a much lower risk, and so I think it's actually helping people know their risk so that they can engage in their life with their diabetes. And so I think part of it is helping people to know that, yes, you can go outside, just socially distance. Because I have some older patients that haven't gone outside in 3 months, and I can't imagine what that's like. So I think part of it is helping people to find that middle ground. And I really hope that we start to develop more things like this, online support for people, because we are going to have to rely on some distance learning as part of our experience moving forward.
Yeah, yeah, thanks for that. And so maybe, I don't know if Monica, if you have a question in mind that you pulled. I've been looking a little bit at the chat, but maybe, Monica, was there a question you wanted to start with for Dr. Schubert?
This person says, I'd like to know if the doctor sees an engagement issue with the telehealth system in comparison to face-to-face interactions. Just because of our current experience, the reach is higher, but we don't see the same level of adherence with some.
Yeah, so what a wonderful question, and go Echo. Nice job for your involvement in the Echo program. There's some people that really need face-to-face, right? When you ask me a question, I'm a terrible liar, not that people lie, but if you say something, I wear my emotions on my face, and that is really important. My body language is important, and that engagement's important. I would say, yes, some people can be as engaged as ever through telehealth. Some people might need that face-to-face and need all that kind of multiple senses. I would also say that one thing that I've really learned through telehealth is I get to see people's lives a little bit more intimately. You know a little bit about me from the pictures behind me, right? I know when a mom is talking to me and she's got 4 kids running around while she's trying to do the appointment, I know how chaotic her life is when she's trying to manage her diabetes that I wouldn't have seen maybe in the controlled office visit. So I think that there are some things I learned that I hope could be helpful for me to help the patients with diabetes. But absolutely, some people just, I had some patients that said, I will only do face-to-face appointments. Let me know how soon I can do it. And that touch is an important thing that we include as much as we can. Thanks for your question.
Yeah, and I would just add, I think that to echo those comments about, there have been plenty of studies that have told us that doing different kinds of healthcare or psychological care, face-to-face versus, remote can be very equivalent, can be the same. People perceive it slightly different, but you can usually achieve some of the same outcomes. But I think that one of the things I always wonder about, if one of the tricky parts about engagement through telehealth right now is tough, is not because of the format or because of diabetes. It's just because of all the things that are going on in the world. And so I think sometimes it may be helpful for us when we're engaging people early on in kind of the telehealth processes, at the same time that we're asking about what's going on with diabetes, and we're also thinking about, what's your take on everything that's going on? What are you doing to take care of yourself in this, stressful time? Are you looking to family for resources? Because it may be that that's become a major barrier and been a little bit harder for engagement. So, and then let's see, another question has come in. Sarah or Monica, you want to chime in with the next one? Yeah.
Sure. So another one, person says, you mentioned downloading patient data in clinics during in-person visits, and this has become difficult now. And so what tech did you use in the clinic previously, vendor-specific tech or some other platform that downloaded multiple devices into one platform?
Yeah, so I've done it all. I can show you the picture of the 50 cords. I could show you the more streamlined things. In both of our practices now, we use what is a relatively universal database. I think and this is not a promotion for one or the other. One office uses Gluco. Another one has used Diasen and Tidepool. So, and it is much easier to have kind of more of a universal platform, but all of them have something that they're missing. So there's benefits for each. And I would encourage someone who's about to do uploads in their office or downloads to find the efficiency of one of those systems because they could really help simplify your office.
Other questions that have come in, Sierra?
Yeah, so this person's asking, have you started doing in-person visits, and how do you decide who gets those appointments versus a televisit?
Boy, so I don't think there's a single answer to that. One of our practices is the patient gets to decide. We'd be happy to do a telehealth visit. If you'd like it in person, you're welcome to that. We're trying to move away from phone so that we're doing virtual visual versus live. In the other office, the default is live, and you have to ask for a telehealth if you want that. And I think there's just different health systems making that decision. We do have protocols in place to protect our patients and to protect us. But I think each practice has taken it differently. And about half of our visits are live now, by the way.
Oh, okay. And what was that transition like for you, to actually go back into the clinic after probably not being there for a little while? What was that like?
Well, so one of our practices, actually, we did telehealth from the office, even though no one else was in the office. So we were required to go there. So it felt okay. What has been a really interesting transition is now we have 3 providers at once seeing patients, and how we stagger those live appointments to minimize patient exposure to each other. So if I remember correctly, my in-person visits come 20 minutes after the hour. One of my others come at 40 minutes after the hour, and the third comes at the top of the hour. So we actually have a mixture of appointments so that there's not too many live patients in the office at any given time.
Okay. And have you noticed any resistance from the people that you see to come back in person? I know that we've talked a lot about, the people's personal preference has been, is weighed heavily in your practice, but have you noticed any resistance?
We've had some say they don't want to come in for a live appointment, and we are
Yeah.
happy to accommodate that. The only time that we really would demand a live appointment if there's something we think they're sick enough that we might need to hospitalize them, because again, that's, we would ask them to see us or go to the emergency room. But we are very happy to accommodate the patient preference to the type of visit.
And I know that I think there's still a couple more questions coming in, but I wanted to put you on the spot a little bit
Okay.
with maybe a little bit about what your philosophy is about. We talked a little bit earlier about, asking people about or telling them about the continuous glucose monitoring, for example, and other devices. But do you have it as kind of a standard protocol within your practice and your own philosophy about introducing devices to everybody, or is it that it's kind of brought up at a certain time? I mean, I'd just like to understand that a little bit more.
Yeah, so I think for people with type 1, we always introduce the concept of technology. And many people have strong opinions. Hey, I've heard about this, I'm not interested. Great, that's fine. People with type 2, as they start to have more complicated regimens involving multiple insulin injections, we'll probably be bringing up technology as an option. But we don't bring it up for everyone. And I think there are many people with type 2 that initiate the conversation about devices. And most of the time they wouldn't qualify, quite honestly. Now that doesn't mean they can't do it. I have patients, some, not many, that can buy these devices, particularly the Freestyle, and I'm happy to work with them to do that. But I think most of the time it's when they're on an advanced insulin regimen that we bring it up. And I usually just say, as we start to plan about things, I want you to know additional resources for you are the following. These are devices that can either deliver insulin, I sometimes call them an expensive syringe, or things that can read your glucose for you and help report back. And so if you want to hear more about those, I'd be happy to talk to you more about it. Specifically, when we look at devices, I really try to be agnostic. And I say that, it's like buying a car. I might like the Honda and you might like the Chevy. So I want you to take a look at them and go and learn a little bit about them. And then once you feel like you have some idea about what you want, I'd be happy to set up a pre-pump class or pre-sensor class so you can kind of put your hands on it and feel and know what it's like. And particularly at our diabetes center where I can place these and let people try them first, it's really valuable for them to be able to say, oh yeah, I want to do this or not.
Yeah, that's really great. One of the things that is in the chat now is a link to, if you have other thoughts on this webinar series, as well as if you'd like to receive the newsletter that we're doing. So essentially what's going to happen is we're going to kind of summarize what we talked about today, put it into a newsletter, also put it on our website, and then try and circulate that. And so if you're interested in that, the link for it is in the chat. So make sure you check that out. Back to Dr. Shuruk, you know, I know I asked earlier about what you foresee kind of coming in terms of just generally in diabetes care, but you know, because of DiabetesWise, we're interested in you know, technology and devices. What can you tell us a little bit about what you see happening in kind of the landscape of devices and technology and how that might affect, not specific to COVID, but just kind of more generally, what do you think is going to happen in the future?
Well, you know, as a person who doesn't have diabetes, and I've tried everything, but you know, it's a different level of complexity when I'm wearing them for fun as opposed to wearing them because of my diabetes. I am just super impressed at how much progress we've made in a short amount of time. You know, I think that while these are just devices that are augmented for our treatment, they really can help quite a bit to stabilize glucose delivery, give good information, less calibration. We know that managing diabetes takes a lot of time. In fact, we did a study that when we surveyed diabetes educators, if you did all the steps of diabetes self-care with type 1, it's like 5 hours a day. Yeah. Who has 5 hours a day? And it's type 2, you're off the hook, it's only 3 hours. So, you know, we know it takes a lot to manage diabetes, and if this somehow makes some of those steps easier, or takes some of the entropy of the life around diabetes out, then I think that's really cool. And for me, you know, doing this for 15 years, I've seen pretty great advances in the insulin pump and sensor integration and smarter devices. You know, for me, these pens that have a memory, I mean, that's wonderful for my patients that don't remember when they take shots. You know, ways we can help people calculate, you know, calculating doses can be quite hard. You know, you need like a math degree to take insulin. And, you know, a quarter of people who graduate college couldn't do it. So I think that anything that we can do to make life a little bit easier, I think it's a good thing. And I really feel like it's getting better and better. It certainly doesn't stop diabetes. It doesn't cure diabetes. But if it makes the management a little bit easier, that's, I think, a positive.
No, that's great. I think that I'm certainly biased because I had the opportunity to work with you for the last few years, but you know, your perspective on this I think is really valuable, and I think that you're a great advocate for people with diabetes and their decision making. And you know, and as a person with diabetes myself, and then there are a number of others on our DiabetesWise team, we appreciate all of your efforts, your philosophy and practice, and the way that you care for people. So I think that's. I think we're going to wrap up there. I think we just had one more question pop up, so I'll go ahead and read this out. Yeah. Go ahead, Sierra.
Would a 2-sensor CGM system provide faster, more accurate readings and less finger pricking?
Ooh, I'm not sure I know that question. So you mean a dual sensor, meaning the sensors are cross-referencing each other, or you're looking at a dual delivery? You know, I don't think I have enough information to answer that. Maybe Corey, you can answer that.
Yeah, I mean, I think that there would be some advantage to having even more glucose data, and you know, because if you think about you know, the CGM, some of these really popular systems still are inaccurate 10% of the time, and so if you have ones that are not inaccurate at the same time, and providing that information, I think that could help. I would say most people wouldn't be willing to wear those that extra device, especially for just such a small added value. But I think that that's an important point. One of the other questions that just came in with COVID-19 changing the job landscape for so many people, what recommendations would you have for people who are struggling to access insulin and testing supplies as a result of insurance issues or financial struggles, as well as anything, you know, around devices? But when that comes up for you in your practice, what kinds of things do you recommend? Where do you send people?
Yeah, and it's a big problem with an incomplete answer. You know, I think some of the insulin companies have gotten more generous about providing insulin, whether that's through a website or through a program or in the office. But there are still lots of people that are rationing insulin because of gaps in their insurance, gaps in their jobs. And, you know, one of the things, and I guess I want to give a statement at the end about primary care. I think we have to remember still that there are cheaper insulins out there, and that if heaven forbid there has to be a switch, we still have to be skilled in using some of the older insulins if that is demanded by that. Devices is also complicated, especially if there's been a break in insurance. A lot of times a change in insurance and new insurance is reluctant to pick up a treatment they've already been on, and that can also be hard. We use GoodRx all the time as a website for pricing medications. We use the patient assistance programs regularly, and sometimes we just go out there and just talk and find as many resources as possible. And all of that still gives an incomplete response. I would, if you don't mind, can I add one thing for providers out there? You know, if I were going to be in a practice that was doing more diabetes, I would really encourage everyone to have a download station at your office. Very few primary care offices actually have a download station. You can save about 10 minutes per patient by downloading data and actually have a more meaningful discussion. I would really encourage you not to be afraid about technology. You know, there is so much support available. You don't have to have a whole team. You don't have to have a diabetes educator in your office. Actually, many of the companies would provide support for you. And so these are things that I think many of your patients would like. And I think if you're going to treat a lot of patients with diabetes, having knowledge about them is really good. And it's okay to have knowledge and say, I don't feel I have the time to manage it, but get your patient to someone that can. Or if you want to manage it, get the information, and it's not as hard as you think. And quite honestly, I think about managing diabetes before insulin pumps, and that to me was a lot harder. It was actually a lot easier to have the technology and the support. And so my role, albeit small, is actually also made quite a bit easier for technology. And so since diabetes is so common, it behooves us to have knowledge and a working kind of knowledge of some of these systems.
Yeah. And I'll put in a plug for a series that we're going to start in July. I believe the dates are July 22nd, 29th, and then we'll roll into the beginning of August. But this same series, we're going to have panels from insulin delivery device company representatives and from CGM companies to talk about the programs that they have for people in this time. And so I think that, you know, we're also going to list those on our website, and we'll also list some of the programs that are offered for the reduced pricing around insulin, which we know is absurdly expensive. So there are some programs available that I think can help. And then our next, you know, one of the other things that you mentioned also made me think our next week's program is about, you know, what happens in this time if your diabetes devices break or if there's some issues that come up. And so we'll talk more about that in the coming weeks, because it is a little bit of a different time, and maybe people have to go back to the low tech side and have become a little bit, you know, unskilled in some of these things. So with that, I think I'm going to wrap up. I want to thank Dr. Schubert for, again, for all that you do for people with diabetes, but also for being with us and being part of this. We're going to have this within the next couple of days. We'll have it online so that people can view it. And then also we'll get out the newsletter. So please follow that link and sign up for that. Anything in closing, Dr. Schubert?
It's been a pleasure. I hope you're all well, and just continue to thrive. And thanks for your interest. Thanks for having me. It's been a pleasure.
Yeah, great. Thank you.
Thank you.